Sexual health. I feel like unfortunately sexual health has been an afterthought in people's career. Certainly for me, I did a lot of other jobs before I then went into sexual health. And I think if I was starting over now and I was a student nurse, I'd be thinking straight into sexual health.
I came into sexual health as my very first job, and that was 15 years ago, and I would encourage other students to do the same. I've never looked back. I love my job. I don't think I could do anything different actually.
Before I went off to do my nurse training, a very close friend of mine actually came out as HIV positive to me, and I was one of the first people he told. So I did a little bit of reading more so around it, and it actually piqued my interest within my second year of doing my nurse training, and then I sort of tailored my assignments and my work, my placement and elective placement in sexual health. So I kind of knew that that's what I wanted to be after my second year of nursing.
So as a student nurse, I had no idea what nursing I wanted to go into. I had the opportunity of a placement in sexual health, and I just fell in love. I was very lucky to get my very first job as a registered nurse in sexual health, and that was 15 years ago, and I've never looked back.
I trained in the early 80s, so quite some time ago, and I did a general nurse training before it was a diploma or degree course. And I was acutely aware as I got to qualifying that I'd had very little input about sexual health as a general nurse, and then I came across somebody on a general ward who had a sexual health problem, and I just realised that I was actually pretty ignorant about sexual health need or problems. So that tweaked my interest in the specialty, and then it was a matter of just waiting for a vacancy to come along in a sexual health service for me to then apply to.
I came into sexual health a little bit by accident. I'd worked in hospitals, I'd worked in acute care, and then a job came up in sexual health, and I thought, this sounds really interesting. And it was, and it must have been interesting because I've stayed for 19 years. So sexual health to me is, is a job which is absolutely multifaceted. And I think it is very different from working on the wards. You know, you're not necessarily working with people who would consider themselves ill or unwell. You don't necessarily see the same people all the time, but I think, for me, that kind of interest that prompted me to apply for the job is what's kept me going kind of all of these years.
Day to day, it's obviously seeing people regarding to symptoms or no symptoms who are just coming for a regular STI screen. We also do contraception as well, so it can be anything from a quick chat about having an asymptomatic screen and sending them off to do their sampling, or a more in-depth conversation around the symptoms that they're having leading to an examination as well.
So day to day my job entails running nurse-led clinics. So we have I work in an integrated service, so that's both sexual health, GUM, and contraceptive service. So we do a mixture of appointments and walk-in, so you truly never know what's going to walk through the door. And so we take a full detailed sexual, contraceptive and health history, and then meet the needs of the patient, whether that be contraception, sexual health, or indeed HIV.
So my job entails seeing patients and completing episode of care. So that means from testing them, treating them, diagnosing them, and management of the infection that they may have, or also management of contraception needs. And that includes fitting coils, implants, giving injections for depot, and oral contraception as well. The other part of my job, which I really love, is developing junior nurses.
My job entails seeing patients on an appointment or a drop-in basis, and people can come to the service for a wide range of sexual health needs. So I provide contraception, all methods of contraception, from the insertion of intrauterine devices to the provision of condoms. And in my service we are specialist contraception, and we do some STI screening and treatment as well. So I may see patients who have got symptoms, I may see patients who just require general screening, I may see patients who have had any sexual problems, who may need referral to our psychosexual clinic.
I see the patient from start to finish, the whole episode of care, so that would be diagnosis of conditions, sexually transmitted infections, non-STIs like thrush and bacterial vaginosis, diagnosing clinical problems such as warts and herpes, taking samples, diagnosing and treating using patient group directions, and then also undertaking partner notification for those patients who have got a sexually transmitted infection. Because part of our role is, it's not just about the patient in front of you, it's about the public health responsibility we have to try and test and treat anybody that might have been in contact with those sexually transmitted infections as well. In contraceptive terms, we assess suitability for all methods of contraception, including long-acting reversibles such as implants and coils. I also am an implant fitter, so I could be using any of those skills as well. I'm also responsible as the research nurse for the PrEP Impact trial, and that's providing HIV treatment as a prevention for patients who are considered to be at high risk of that infection. And that's part of a national study called PrEP Impact. So part of my clinics would also be dealing with those patients and issuing them with their repeat prescriptions. I work mostly at Macclesfield Hub, but I also go to some of our peripheral clinics as well, and some of the harder to reach patients in those areas of greater need.
So it's a really, really varied job, and I think that it's getting more and more diverse, both from the people that we see, but also the reasons that they're coming to the service. So it is a really, you could be doing something different every single day, and again, that's what I really enjoy about sexual health.
What I really like about my job is the fact that every day is different. There's also an aspect to people are coming in and they're quite vulnerable, because as a society I think we're quite reserved when it comes to talking about our sexual relations. So people do tend to open up quite a bit, and sometimes they'll tell you something quite shocking, but then also you get to help them. When you have people walk in who are quite anxious and quite upset, and if you can resolve that after your consultation, they leave happy, that's actually quite a nice fulfillment.
So I love my job because I can get to make a difference in my patients' lives. I get to make a difference in other nurses' lives. I've really loved growing, not only me as a nurse, but other nurses as well. I love teaching. I love that as nurses you can make a career out of sexual health, and I love that aspect of the job. I love making a difference. I have enjoyed seeing the journey of sexual health in the last 15 years. When I first started, for example, HIV was palliative care, but now people are living long, fulfilling lives, and it has been great being part of that journey.
I really like about my job is meeting somebody and very quickly being able to build up a very good rapport with those patients, because quite soon into a history-taking episode you're asking about the most personal details of somebody's sort of sex life, and to be able to make a patient feel very comfortable and okay in that sort of situation is really important. And I think patients expect to come to a clinic and possibly be judged. They're often very worried, they've got high anxiety, and sometimes patients are actually fairly angry about their reason for attendance, and it's being able to manage those emotions in a sensitive, non-judgmental way. So I feel as a sexual health nurse, my ability to communicate with a whole range of people about really difficult things is what makes a really good sexual health nurse.
My job, the thing I like most is I like the autonomy. I like the fact that a patient comes into my consultation room, and more often than not I can do everything that patient requires within that room. They only need to see me, and I think that's really important, because I view sexual health as an art. There's a lot of science to it as well, but it's an art in that person walks through that door and you've got to strike up a rapport with them instantly, because they could be about to tell you things that they've never told anybody else. They're not just coming in with a spot or a lump. They're coming in with all of those emotions, all of those relationships, all of those issues that sexual health kind of encompasses, and you've got to be able to embrace that. You've got to be completely non-judgmental, and you've got to be able to have that patient trust you, trust that you're going to do what is best for them, and trust that, you know, everything is going to be in their best interest so that they can have, you know, a safe and fulfilling and enjoyable sexual life. So I really enjoy that, and you know, I enjoy that satisfaction of, you know, having somebody come in who might be really worried, and hopefully, you know, they're leaving feeling a lot more comfortable than when they first set foot in the door.
It is a really viable career option. It's not just all about working on the wards. There is a whole world out there where you can become very specialised, and there's great opportunities as well. I mean, for myself, I have been qualified 3 years in March, and I'm already a band 6 because I chose this path quite early, but also the opportunities that were given to me I took, and also worked really hard for it as well. So it's not just all about the wards, there are other options out there as well.
The journey has been a beautiful journey, but the beauty of it now is I can get on to pass on my experience to others. I love teaching others. I also know that there are not ready-made contraception or sexual health nurses out there. So without experience, please come and join us. And I came to sexual health straight from being a student nurse, and I have learned so much in the time that I've been in the career.
I hope that sexual health has been sort of considered as part of your training, and that you have been able to ask some questions and find out more information about all the specialties, so STIs, HIV, contraception. And I'm hoping very much that you've had the opportunity to visit a local service if you've not been able to do a placement on sexual health. It's certainly something that if you haven't done by now in your training, that you should be asking to at least do a spoke visit and get an insight about sexual health, because it truly affects everybody. And what you thought you knew about sexual health, or you thought you knew about patients that you're seeing, is probably wrong. So it's really good to challenge yourself and go into a sexual health clinic and challenge your preconceptions about our client group and how they are.
It has been a very fulfilling career. I have enjoyed learning. I have enjoyed growing as a nurse. When I first started, we were mainly assisting the doctors to see the patients, but through education, through development, I can complete an episode of care myself for the patient. I can prescribe, I can fit coils, I can fit implants, I can diagnose infections, treat patients, and that is a very fulfilling part of my role.
I think things are getting better. I think it used to be that, you know, you had to have had experience elsewhere before you came in to sexual health, but I think why should it not be people's first career choice? You know, it's fulfilling, it's satisfying, it's, you know, you're like a little bit of a detective sometimes in terms of trying to work out what might be going on for somebody, but it's that art form. You know, if you want to work somewhere where you're really building relationships with people, and, you know, you're able to kind of leave having, you know, made that difference to somebody's life, you might never see them again. You know, sexual health is very episodic, but, you know, you might have made that difference. So I would definitely say to any student nurses considering a career in sexual health, go for it. I also think that, you know, it is becoming more of an absolute career. I'm aspiring to be a nurse consultant, and hopefully I will get there, you know, within my career.
Please consider a career in sexual health. It's a very fulfilling role. It's a role where you can grow, where you can develop yourself. I have worked hard to get where I am, but I couldn't be more happy.
There's a real career pathway in sexual health, and I would, you know, I would encourage anybody just to take that plunge and go for it.